What I'm doing today is talking about the tale of two literatures. And I call them the public health literature, and I'll call this the public health studies today. And these are primarily published in public health journals and medical journals by non-economists. But they're doing economic studies. And what they generally do is find no claim, and there have been hundreds of these studies, literally. Not only do they not cause any pain to any type of hospitality venue, bars and restaurants for the most part, and many times they produce beneficial impacts, and therefore, in effect, the owners of these businesses should thank those that impose these smoking bans on them, which is, to an economist like myself, it's like water running uphill. It's like, what? How could they know the business better than the ones that are the observers on the outside trying to impose these regulations on them? So I have a choice quote there by Erickson and Shalupka in the Journal of Cancer Studies or something like that. Came out in 2007, but many of you, I'm sure, have seen the one that was done around 2003, a literature review with Glantz, Stanton Glantz, and three others. And this is almost verbatim what they said, too. So let me just read it. The vast majority of scientific evidence indicates that there's no negative economic impact of clean indoor air policies, with many studies finding that there may be positive effects on local businesses. So everybody should be happy. All right, so the other literature, which I'm going to argue is hardly ever mentioned in the public health studies, are the economic studies. And these are primarily in economics journals, and they show some level of harm, which to an economist is, well, I would think so. The question is, how much harm? And the interesting thing is that the economic studies are more of a reaction to the public health studies. In fact, most economists would say, we don't even need to study this. We know that if we're going to impose an exact or a total prohibition, somebody's going to get hurt. But here we have these public health studies saying there's what we call a free lunch. And that is, everybody gets to eat for free. And it's really great. And if, I'd love to believe that. I think we all would, right? So the question is, does it make any sense? All right, so today, to summarize it, I'm going to talk about the evidence for restaurants and bars. There's some on gambling venues, too, which I have a paper that I've talked a little bit about those. And then I want to end up with talking about what are the unfortunate consequences for misleading the public about the economics of smoking bans. All right, so first off, what's the economic theory? The conventional view, and the one that is used by the ban advocates, is just simply that smoking is what we call a negative externality, that there are costs imposed on another party, and therefore we need to somehow integrate that cost into what we call the private market process. So what we tend to do, it's called a Pigovian solution, is to tax the externality. And in this case, the tax of a smoking ban is like an infinite tax. It means you don't get to do it. And to most economists, they would argue, well, banning something entirely, if it has both benefits and costs, doesn't make any sense. But I think mainly most economists are non-smokers. They go, let's just get rid of it. Let's just do that. All right, so, but the counter view, and this is what really got me into this issue, is from Ronald Coase. And the Coase theorem says the usual approach that economists take, and he wrote this in the early 1960s and then later got a Nobel Prize in economics, one of my favorite economists of all time. He says, no, you've got it wrong here. It's that externalities are reciprocal in nature, and that is, it's just like when I have my kids, I have two children and they're fighting all the time. And when I ask who caused it, each one blames the other. Well, they're reciprocal in nature, and same with when we look at smoking. Smokers think the problem is that the non-smokers trying to get them to stop, and in the other direction, it's the non-smokers think it's the smokers always at fault. The problem is, if you don't look at it this way, you don't understand that there's a private market or a free market working here to try to deal with this through negotiation. And this is exactly what Coase brought out. So in other words, there is a market, a free market that's trying to allocate resources based on negotiation between smokers and non-smokers. If you don't understand this, you would be very apt to just say, hey, let's just ban it and move on. What's the next question? So there's a range of solutions according to Coase, where resources are going to be allocated to the highest valued users. The usual response to this by a ban advocate is that, oh, in theory, this sounds great, but nobody owns the air, and therefore the Coase theorem can't allocate this scarce resource. And I thought about that for a few seconds. I said, I don't think so. If you look at a restaurant or a bar, that airspace is owned by the owner. And what the owner is trying to do is to maximize the value of their business. So what do? They look at who they can sell to. So what you're going to see is a range of solutions, so that when you have a restaurant or a bar and it's catering to a lot of non-smokers, they will be more apt to put the airspace toward the non-smokers. And in the other extreme, you're going to, if there are a whole bunch of smokers that are doing this, it's going to be more tailored toward the smokers, and then you're going to see something in between. So it's not a one-size-fits-all, as we say, response. So the question is there a private market doing this? And there is. I've done some research. There's not much. And if you read the studies by the public health, they never raise the issue of whether or not private markets try to deal with this. I've never seen it. So it takes somebody, I guess, like me, who's suspicious of government intervention, and I really want to try to understand how private markets work. So I did a study. I know I have limited time here, and I could talk about the first one, but I live in San Luis Obispo, and that's SLO. And if you look in Wikipedia, one of the things that they crow or herald in there is that we were the first city in the galaxy to pass a comprehensive smoking ban on all restaurants and bars. All right, so what I noticed, though, was before the ban was passed around 1990, is that my wife and I, who are non-smokers, had no problem finding non-smoking restaurants. None whatsoever. These are the type of places that are going to pass a ban first. Okay? This is supporting what Coase was arguing. So what we did, William Boyes and myself, is that we surveyed all the restaurant and bar owners, each and every one. We had a fairly high completion rate of those surveys, and here's what they were doing. Before the ban, 61% of the owners tried to deal with the smoking issue in one way or another, often by smoking, non-smoking sections, smoking patios. And when we also looked at, we had about 3,000 survey responses from just people walking around the town. We found that 62% of the non-smokers believed that the smoking sections were fairly effective. They weren't that bothered. Okay, you never hear this stuff by those that are advocating bans. All right, so John Dunham and I also did another study. We looked across the United States at restaurants and bars, and we did it nationally representative using a big-time survey consultancy to get the data for us. And we saw that the average seating for non-smoking sections for restaurants across the United States was 54%. They're dealing with it. Bars, on the other hand, it was only on average 5%, and in most cases, most bars allowed smoking throughout. Why? Their customer bases are so different. This is exactly what you would expect for an efficient allocation of resources. 40% of the restaurants there allowed smoking throughout. So you also had quite a few, and I don't remember the number, that just forbid all smoking voluntarily.